I've had a rhinoplasty and I'm not happy with the results. What can you do to fix it?
Well, I can revise your nose. The fact of the matter is that's a large part of my practice. Vision rhinoplasty is fairly common, so you're not the only person who's had this problem. 30 to 40% of all rhinoplasties result in revision. Fortunately not in my practice, but if you take all comers around the world, so you're not alone. Anytime I do a revision rhinoplasty, I tell people it's kind of like Forrest Gump and it's in that box of chocolates. You just never know what you're going to get. I really never know what I'm going to get till I get in there. So I typically use what's called an external approach when I do revision rhinoplasty. I would say the vast majority of the time, so I can see precisely exactly what the anatomy is. And based on whatever anatomy the doctor has left for me to deal with, I have to typically go and find parts to fix what's been done. And those parts almost always consist of cartilage or gristle. And I get those parts from inside the nose, what's known as the septum, the partition that goes down the center. I sometimes have to go to the ear, this part called the conchal bowl, to get the necessary parts. I can't recall having a revision rhinoplasty where I did not make them better. I tell all my revision rhinoplasty patients that I can't look them in the eye and tell them I can do this as well as I can do a virgin or a first-time nose, because that's just not the case in general, or it would be, I think, misleading. But I can tell you that the vast majority of my revision rhinoplasty patients are happy they did something. If I didn't think I could help them, I've been in business. I'm almost 60 years old. I don't need to do surgery that I don't think I can help. So I would tell them they should not have the surgery.